We know flu comes around every year, and indeed this time last year we saw a steep increase in the number of flu cases last November. That had impacts on hospital activity. It had people being admitted to hospital as a result of flu. What the flu vaccine does is reduce the severity of illness for flu. And that's why I'm really encouraging everybody who's over the age of 50 or has a long-term health condition to take up the offer of the flu vaccine. We also have the children's intranasal flu vaccine programme, and that's because we try and reduce the amount of flu circulating in the community to protect the elderly. I'm worried at the moment that uptake has been quite low, and this is why we're offering walk-in sessions at the GHA. So you can walk in, you don't have to have an appointment. If you're in one of those at-risk groups, you can walk in an evening from 5 till 7:30 and we'll give you a vaccine. And we are bringing the vaccines to the public. We're going to have the ambulance there giving vaccines on Saturday morning in Casemate Square.
OK, so let's unpack. There's quite a lot in that answer. At-risk groups, remind us who are at-risk people.
Basically, if you have any long-term health conditions, so if you have a long-term lung problem, heart problem, kidney problem, if you're on dialysis, if you've had treatment for cancer, it's a very broad definition. We're also offering the vaccine to people who have very close contact with people who have long-term health conditions. So if you have a parent or a grandparent who has a long-term health condition and you have significant contact, you can have one too.
Not as many people having the vaccine as you would have liked. Have you got any theories as to why that is?
Yes, the feedback we've had was when we launched the programme, we were in the midst of a general election, and I think a lot of that messaging then got lost, understandably, as a result of coverage and interest in the election. That's why we're doing a real push on it now. I had a look earlier in the week and we've had 1,600 or so adults take up the vaccine. That's very low compared to where we're normally at.
What are you hoping for?
About 6,000.
Oh, wow.
So we are quite a way off yet. So that's why I'm doing a real push now to try and get people, if you are eligible, please take up the offer.